Hello everyone, my name is Guadalupe Brugada. I'm a current student in medical terminology for the fall of 2021. I'll be presenting today on a medical condition called Chiari Malformation. This is a genetic condition and is a condition that I personally suffer from. I have Chiari 1 malformation and hydrocephalus, and I also have a shunt. My mom and my grandma also have Chiari malformation. Chiari malformation was discovered by a German pathologist and professor named Hans Chiari, hence the name of the condition was named after him. He noted abnormalities in the lower part of the brain that protrude into the spinal cord. He named each condition based on the severity. There is Chiari malformation 1, 2, and 3, and 4. In essence, less than 1% of population has some form of Chiari malformation. Chiari 1 malformation is the most common of all the forms and is most commonly found in children. Moreover, if there are no severe symptoms, then no medical interventions are necessary. As you can see from the picture of the x-ray to the right, the lower part of the brain is protruding into the spinal column. Chiari malformation 2 is also known as classic Chiari malformation or Arnold Chiari malformation, since the German pathologist Julius Arnold discovered that Chiari 2 is also typically seen in children who also suffer from spina bifida. Another one of our classmates did a presentation on spinal bifida. You can watch that presentation to learn more about what spina bifida is and how it affects young children along with Chiari malformation. Chiari malformation 3 and 4 are both very rare but also very severe and have very severe physical abnormalities. For instance, for someone who's suffering from Chiari malformation 3, they will have some part of the brain that will be protruding from outside of the skull, where someone who has Chiari malformation 4, they would be born with part of their brain missing. And you can notice those abnormalities in the x-ray pictures to the right. Some of the most common symptoms are headaches and muscle weakness, but this is also a list of other common symptoms someone might experience. Not everyone would have the same symptoms. Everyone might experience different symptoms, but some are very, very painful and will be experienced over a constant period of time. In addition, other medical conditions can also be diagnosed in conjunction with Chiari formation. I shared in the beginning of the presentation that I have hydrocephalus along with Chiari malformation. So, Chiari malformation can also be associated with spinal bifida. I also shared that earlier as well, but it can also be associated with spinal curvature. To be diagnosed with Chiari malformation, either a CT scan, MRI, or X-ray must be done, and it must be read by a medical professional. Typically, a neurologist or neurosurgeon must review and diagnose someone with this condition. It can be done either in the hospital or urgent care or someone where the medical professional works. The surgery itself can last as long as 6 hours and is very risky since your body is open and exposed for a long period of time. The surgery itself is called posterior fascial decompression. It is removal of the lower part of the back of the skull and possibly the back of a cervical vertebrae. I'm missing part of the back of my skull and the cervical vertebrae. This allows for the pressure on your brain to decrease. If someone has hydrocephalus like myself, then a shunt can be placed near the swollen ventricle to allow the fluid to be drained to another part of the body. Medical terminology words that I used throughout my presentation was neuro, which means having to do with nerves or the nervous system, or hydro, which means water. Thank you for watching my presentation. I hope you learned valuable information about Chiari Malformation. The next slide lists all my references. Thank you.